All right, Hannah, thanks so much for doing this. My first question to you is, tell the audience a little bit about yourself and how you started in the mental health realm.
Yeah. So I came to mental health from a more medical model. I was originally, I come from a nursing household. A lot of my family is nurses, so I sort of started down that track. At 18, when you don't really know what you're supposed to do with your life and you haven't really individuated much. So I did nursing for a while, and then I moved into more public health and more administrative work. And I graduated with my degree was in public health, and I was working during COVID as a contact tracer and trying to decide sort of what was going to excite me for the next phase of my life, and feeling a little bit underwhelmed by some of the opportunities uh, for public health. And so I had a friend who I was talking to who was a social worker. And I didn't know what social workers were. I thought they were just people who, worked with child protective services. But she explained to me that no, it was more of a social justice lens on mental health, and a lot of them worked in clinical counseling, and there was a lot of opportunities to work in different settings. So I was actively applying to my master's in public health, and they actually had a dual degree program with social work at the college I went to in University of Utah. So I just applied sort of on a whim and got in, and ended up actually really appreciating and loving that work even more than any opportunities like on the more macro side of public health. I really liked the clinical work, and I wanted to work more hands-on with people, boots on the ground. So I worked in some addiction counseling. I worked in some private practice, but I always still was interested in healthcare, in the intersection of mental health and physical health. And so I ended up working at a hospital as a behavioral health consultant for chronic illness, for the women's clinic, and that's how I sort of started working with that population more heavily. And I really loved that world, and being able to offer services and mental health to people who sort of otherwise would never have come in contact with it, and being able to, I guess, uh, fill that gap that I felt there existed in uh, a clinical hospital setting. So,
Mm,
yeah, sort of the short and sweet of it.
yeah. My next question is, so tell me a little bit about the work that you do in your current role. I know that you said that you worked in a women's clinic before. Is that still something that you're currently doing, or is it completely different?
Yeah, that's a good question. So I have sort of transitioned. I moved out of state, and now I'm living in Washington. And through that move, I also I'm an associate therapist. So I'm not fully licensed as a independent therapist. I work under where I have supervision. And so through that, there wasn't actually the job and the position that I held at the hospital no longer really had there wasn't a ton of opportunity for that. The University of Utah is very surprisingly very progressive in regards to their mental health services. And also I was a student there, so I was able to kind of work seamlessly into that position, but it didn't trying to re-enter the behavioral health in hospital or clinical medical settings was a lot more challenging than I expected it to be. So I wasn't really able to make that parallel um, transfer in Washington with my level of licensing. So I instead um, went the private practice route. I started my own private practice um, to kind of afford myself that flexibility in working with the clients I wanted to work with as I gained licensure. So currently I do I do work with a fair amount of people with chronic illness because I still wanted to serve that community, but it's outside of the medical model, and I'm not working on like an interdisciplinary team. I'm much more kind of out in the outskirts, and there's a little bit less collaboration, which I miss. Um, but I'm still able to work with that population a fair amount. So that's been yeah, that's been good.
Mm-hmm. My next question is, like, what sorts of modalities or approaches do you use in your current role? Because oftentimes, I don't know if you've heard about this, but CBT, cognitive behavioral therapy, there might also be some relational strategies, but related to your particular practice, what modalities do you currently use?
Yeah, that's a good question. Definitely it depends on like my chronic illness clients or my clients experiencing chronic illness. I think I use a slightly different lens. I really work pretty heavily with Jungian psychology, actually. And that interfaces pretty nicely with IFS or internal family systems. I don't know if I'm sure there's been some talk of that. Which I think is in some ways when you kind of step back, a lot of it starts to look the same. It's just repackaged in different formats, but I do like to use IFS as a framework, but I guess to serve the end of using a more yeah, a more broad Jungian perspective on mental health, on the treatment of mental health, and I guess that's I find that to be a helpful overlay also for chronic illness. But sometimes I find, you know, just good old fashioned, yeah, CBT, DBT skills, like a lot of times it's just a matter of psychoeducation. Like, here's what's happening in your body. How is your body, um, how are the functions of your body uh in a feedback loop with your mental health, and how are these two things affecting one another pretty heavily, like that mind body dualism that really exists in medicine, trying to like deconstruct some of that dualism and help people understand how interconnected these two things really are, which isn't necessarily any particular modality, but yeah. And then I guess I think it's back to sort of how I would utilize union therapy, because that's a really esoteric, vast body of work that can be implemented. Like, I'm not a union analyst by any means. But I really like the hero's journey. Are you familiar with like Joseph Campbell?
No, never heard of it.
Okay. It's this, I actually have it right here. It's the hero, I mean, The Hero with a Thousand Faces is the book by Joseph Campbell. It was kind of inspired by it. I don't want to go too down the rabbit hole with that one, but it really presents this framework of uh how do we find meaning in life? How do we make meaning out of the experiences that we are sort of I don't know, I don't want to say forced into, but the things that we don't choose that happen to us, like how do we make meaning out of those circumstances, and out of the more like the more narrative therapy lens of how do I look at my life and make meaning out of it, and then how do I use that framework to navigate and move through like additional challenges. So in the hero's journey, there is this uh you know concept. It is like Mulan. It is the framework that you see in basically any modern um, epic tale, right? Like Odysseus. Um, and the whole point is that there is a lot of commonality. There's a lot of common threads through all of history and mythology from all different cultures that have these similar themes and threads of how does a person sort of individuate from childhood? How do you move from being a woman, or sorry, a girl to a woman or a boy to a man, and then how do you separate, right, from your parents, from your family, from what is known? How do you enter the unknown? And then how do you learn based off of, navigating the experiences that life kind of throws at you? How do you grow and evolve and gain the knowledge that you need to in order to move into or transform into the next version of yourself that you need to be to show up in that next phase, right? And the idea is eventually like you are making the unconscious conscious is kind of the Jungian lens, and then arriving at a more whole, um, uh, arriving at a more whole and like fulfilled state, which is a really simplistic. I feel a little bit guilty in describing it so simplistically, but I think if I were to go on, we could turn this into a 5-hour podcast or, 20. So I'll just leave it at that.
Yeah.
Um,
Yeah, it's a pretty interesting book. Fascinating, for sure. My next question is like, how does union therapy differ from like other types of therapy or other theories? Because I'm sure if you've heard of the Gottman method and that kind of stuff, but how does that differ, so to speak?
Yeah, so it's a much less manualized. So first of all, I guess like to explain a little bit, like Jung was a student of Freud, so this is like a much more he really was one of the like fathers of psychotherapy. So this would be kind of like saying I'm a Freudian like therapist. It's not to say that this is not like a specific manualized training where it's like, okay, step one, step two, here's these um, really neat and tidy steps that you can take with clients and how to engage with certain specific topics. There is some of that, but it's much more, if you want to become like a Jungian psychoanalyst, that takes, I think it's 4 years of sort of specific training. So it's a really, really broad umbrella of work. Um, and I am doing a training in Jungian psychology, but I'm taking it through the lens of more specifically quarter life individuation. So people between the ages of 20 and 35, and how you transition through that phase of your life through working with these poles of meaning and stability and navigating um, your own personal, I guess, relationship to how those two things show up in your life, and how to find more balance, if balance can really exist. But, it's always a dance of some kind. But I guess how it differs is it's a little bit more existential, it's a little bit more spiritual, it's a little bit more it's a little bit more focused on the individual's experience versus applying a body of um I don't know, versus like I'm trying to think of, I can probably explain that better, but it's a little bit more like, how does this individual person's journey, um where are they at, and how can you help them navigate these transitions through their life, using like dream analysis is really common, or using just different like active imaginations a really common tool, um, or just identifying patterns and complexes and these unconscious, um, identifying parts of our unconscious that sort of seep up and show up in our day-to-day life and affect the way we engage with the world and the way we engage with other people, but that we are not really aware of, or that we don't really have any control over because they are so unconscious. So helping some of those patternings become more conscious, which is more like CBT, I guess, as a good connection of like, what are some of the thoughts? Where does that thought stem from? Which would be a little more developmental psychology or attachment theory sometimes. Like, okay, what was it? What was it like? A question I really like to ask is, um, how did you know your parents were angry? Okay, that's going to give me some really good insight into how you resolve conflict and how you sort of engage with the world, because that part of or there is a part of your parents' sort of teachings and philosophies that exist in each of us. whether we agreed with them or not, right? And sometimes if we really disagreed with them, they actually become more unconscious and can become more insidious in some ways because of that. So it's just a matter of like shining a light in some way on, uh, yeah, shining a light on all of those parts that are not as conscious. Does that make sense? Did that answer
Yeah,
your question?
it really it does.
Okay.
What I was gonna ask is, like what do the therapy sessions look like? How do you sort of apply that sort of union therapy to, sessions with patients? What does that look like?
Yeah. That's a hard question because everyone is really different. First of all, I don't use union therapy with everybody. I don't think it's for everybody because there's some people who really just want to stick to the like, what is some practical application, and the theoretical knowledge part feels less important. And like a lot of times, especially if they're just in survival mode, I'm not going to try to force us down like this philosophical wormhole, I guess. But some people are really curious about like that, about who they are and that more existential like meaning making. How am I making meaning of this experience, like of my with my chronic illness or with I have a lot of clients with POTS, and it's kind of this unknown, fearful, it just brings up so many of those unconscious sort of complexes that we're talking about. And I think something that I really like to do with clients as a foothold in is dream analysis or talking about their dreams or um, doing a lot of mindfulness and kind of active imagination with mindfulness. So what's coming, like re-engaging with the body, doing some somatic work, and then seeing what's coming up, like what is arising as you're sitting in your body and like being still and quiet and just really fully present with that experience. Because oftentimes, if you're in pain or if you've kind of made an enemy of your body because it feels like it's betrayed you, right? There is this disconnect that exists. So trying to heal sort of that connection and that that conflict in order to access some of the information, I guess, that's stored in the body is something I like to do. And then just really bringing people through the question of like, what is the life task here, or what is wanting to be seen, what is wanting to be felt, what information, like in the hero's journey, right? If you fight the dragon and you slay the dragon, you get the gold, right? So if you're in this and that gold is sort of the information or the thing that you need to transition or to move into this next phase of awareness or of self-discovery or whatever you want to call it. And so I guess asking people like when they're really struggling, what is just getting clear on using this framework is to get clear on what is the goal? Why are you in therapy? Why are you coming here? What are we trying? And like what do you want to alchemize almost out of this experience? Like what do you want on the other side too? And sometimes that changes, right? Through like the course of therapy. Sometimes someone says like I want to, use this as an opportunity to um, get more clear on my job. Is my job fulfilling? And then sometimes along the way, it's like, oh no, it actually was this very other thing, or there was this huge other thing that needed to be realized. So that helping people with that flexibility and taking a step back, but also zoning in on our goals of where do you want to go and what do you want to make of this and make of your life more broadly.
Hmm. There could also be like other examples too that applies too in terms of like relationships. Is this the relationship that I want, and do I feel comfortable going forward with this? Because people go through changes and iterations.
Yes, yes, and that there is inherent risk, right, in loving because hopefully people are changing and hopefully you're changing. And can you navigate that together? And like the thing that you both wanted going into the relationship changes, and that's 100% true. Yeah.
My next question is like, what are some of the common responses that you've seen with patients, in the therapy sessions? Because our discussion is mostly based on self-discovery and kind of finding yourself. So what are some of the common themes that you've noticed? Um,
Ooh, a good question. Common themes. I mean, it depends on the age group also, right? But also it doesn't. I think there's this interesting commonality in people I work with who are between 20, again, that quarter life, like 20 and 35. These questions about life and who am I and what do I want to make of my life and and how am I creating meaning? What are my values? Um, that there's kind of a shakeup that happens around midlife that where people start asking themselves these same questions. And, through going through the changes, all the big life changes that happen at midlife of um, retirements, a lot of like divorces happen around then, a lot of your children leave the home, like your role and your how you see yourself as a parent, as a like through your vocation, the identity derived through vocation, the identity derived through marriage. Some of these things fall apart, some of these things um, are lost, and the question of remaking yourself into a new person, like who do I want to be? I think that I think that some of the most common questions are sort of related to definitely relationships, like how do I show up in a relationship and how do I develop a community or a partnership that feels fulfilling. And then also, like how do I develop a career and that doesn't need to be, or I guess like a vocation of some kind that feels meaningful. And that doesn't always need to be your career. I think frequently that can be, a passion project or something else that brings you a lot of meaning. And how do you interact with that in a way that is, um, I don't know, authentic and fulfilling, I guess. And these are all questions that I never have the answer to, which is what's so hard about my job is I never have the answers. It's like, I don't know, you tell me. And people hate that. People hate that. And when I've been in therapy, I've hated that also, but I do realize that, people have to come to their own conclusions. All I can do is encourage curiosity, right?
hmm And to that end, I always ask therapists this, like, what have you learned in doing this kind of work in therapy, but what do you still hope to learn in terms of something new?
Oh my gosh. I don't know anything. I'm just excited to learn everything. I think like I I don't I truly feel like I have just scratched the surface in almost everything, which is why like when you ask me these questions and I want to go down these I want to really mine all of those or yeah, mine all of those veins of knowledge, I guess. And I think a lot of them run almost too deep to really conceptualize in a lifetime. So I'm trying to be, especially coming out of college where you're like, everyone's there, you're being told what to learn, you're being told what kind of information you need to have to move into the profession. And now I'm really trying to um uh you know focus in and become really clear on what information like what do I want to learn and how can I show up as a therapist in a way that I feel like is authentic and like the most what do I have to offer specifically like with my the way my brain works and the way I can help people. And I think that learning a lot more about specifically some of these more broad topics of knowledge, like Jungian psychology, like if I could really dig into that more. I think that's the focus right now is to be able to make that more applicable. Like that question of how are you applying that in session? I would like to be able to apply that knowledge a lot more practically and less and just have all this sort of theoretical stuff floating around my head that it's sometimes hard to like tie down to how is this helpful? What's the point of this, right? But also knowing that that's not always that desire is not always helpful to kind of sometimes being in that space of the gray area and the more nebulous, like, I don't know, what are we all doing here? Like letting it be nebulous is sometimes important too, and sitting in that, helping people sit in that by sitting in it with them, I don't know if that answered your question, but I want
Yeah,
to learn a lot of things.
yeah,
And I
yeah.
don't
It pretty much did, yeah. If I could really ask this last question of like, how can students, who are entering the psychology field, what can they sort of take away from this conversation? How can they sort of use union therapy to and apply that to whatever practice they may um go into? Because you talked about your journey from the medical sort of side of things to the more practical side of things, your professional, your private practice. And so what tips would you give for those entering the mental health profession?
Yeah, that's a really good question. I'm trying to think of, I think how, oh gosh, there's so many things. Um, I think that for maybe this isn't through the Jungian lens. Well, it is kind of because it's, I think, this idea that we each have our own individual path and that that is separate from like other people's uh like what other people have the capacity for is not what you have the capacity for. And that's the point, I guess. So I think not doing things, not getting trainings just because other people are getting them, like being very intentional about what lights you up, like what energizes you and what excites you as a therapist and following that bliss. Like, Joseph Campbell has a quote that is follow your bliss and doors will open where there were only walls. And I think following your bliss is that they're like it can be anything. It doesn't need to be Jungian psychology at all. But like what excites you, what energizes you, because that's what's going, because this is a hard profession. And if you're not excited about your work and what you're learning about and how you're applying it, your clients are going to feel that. You're going to feel that. If you burn out, you're not able to help anybody. So just like getting excited, finding something, it can be anything. It can be something really silly and small, but something that excites you and like lights that fire, and then just following that, until maybe it doesn't burn, until it doesn't light you up anymore, and then finding something else and following that, and just really being guided by that feeling and by that intuition of something that you're passionate about, and not and trying to put the blinders on when it comes to this like idea of what you should be doing. Like, oh, if you're not certified in EMDR, then you're not a real therapist. You don't really have anything to offer. Or like people, if you want to treat trauma, you need to have this training. And it's like, no, you don't. You need to just have whatever training is exciting to you. And that,
Hmm.
you know,
Yeah, and also like reading books, right? Like that book that you showed earlier, that's also a good resource.
yeah, just read stuff. And if it like just expose yourself to a lot of different things and cast a very wide net, I think, and you will find something that resonates. Um,
Mhm.
you're in this profession because you care.
Yeah, exactly. All right.